The Health Fix podcast teaches you how to take charge of your health naturally by giving you the information you need to elevate your health.
Hello there, health junkies. Welcome to another episode of The Health Fix. I'm your host, Dr. Janine Krause. On today's episode, I have Dr. Colin Dombrowski on. He is known as the Foot Guy, and he's a specialist in footwear and orthotics. He's a husband, a father, a foot specialist of 20 years. He's an author, he's a researcher, an international speaker, and he just helps people get back on their feet by sleuthing out their foot puzzle. From Olympians to octogenarians, that's a word, with arthritis, he's a guy that gets them better. Dr. Dombrowski's clinic is Soul Science. He's located in London, Ontario, Canada. He works in the world of shoes, orthotics, rehab, and his special ninja skill is finding out the things his patients need and being able to be passionate about getting them for them. So he's a patient advocate at heart. Dr. Colin, welcome to the Health Fix.
Thank you so much for having me.
So we're going to be talking all things feet today.
I love it.
And I'm super excited about it because I, as a doc and an acupuncturist, see a lot of folks with plantar fasciitis. And, sometimes you get to the point where you're just like, oh my gosh, this poor person, they can't walk, they can't stand, nothing's fun. It's not fun anymore to live.
100%. Plantar fasciitis can be so brutal. It feels like you've got an ice pick rammed into your heel, taking those first 10 steps in the morning. I can't tell you the number of people who come in and say they crawl to the bathroom first thing in the morning. Mm-hmm. And it's just, so epically bad. And they've lived with it for 9 months before they've sought out treatment or care. Now, there's some lucky ones out there that get relatively mild cases, but, by and large, it's not fun to have. And speaking as someone who suffered through it, both, as a patient and then, who treats thousands of people with this condition over the last, amount of time, I can tell you, even being a specialist and knowing how to do all the things right myself, I still took 18 months to get better from mine.
Man, yeah, 18 months, that's, for a lot of people, that's like a drop in the bucket. So many people are years of dealing with this and, countless steroid shots into the heel and all kinds of gadgets from the foot boot at night, which is very sexy, by the way, to multiple orthotics. And I find it interesting that you're noting that there's some myths about orthotics and you're talking about foot strength and arch strength. And I want to dive a little bit into that. But before we get there, let's talk a little bit about how your 18 months of it kind of played out. Were there some things that were kind of warning signs that you might be headed there? Because I think, also by talking about plantar fasciitis, we should talk a little bit about the warning signs that things might not be going so well.
Yeah, mine specifically didn't start out with any warning signs. I had a small tear. And so I have a couple of young kids. And when my son was really, really young, he was, walking towards an open baby gate. And I launched myself up off the ground. So I was in like that full extended toes back and just pushed so hard and I felt it go. And I knew right then and there. But, it's way better than letting him go down the stairs by himself when he was so young. And then that just wound up with being, brutal over the whole time. But certainly what we hear from people is that it crept up on them. They were waking up in the morning. They felt some twinges in their arch, some twinges in their heel. Maybe it was after a particularly, hard and vigorous day of gardening. Maybe it was that they got back into a running program, dusted off the shoes that were old sitting in the closet, and just did too much too soon, too quickly. And it just never got any better. And then all of a sudden, one day they woke up, put that foot on the ground and wow, got a shot of their lifetime.
Oh my goodness. Yeah, it brings people to their knees. And like you said, crawling to the bathroom, things of that nature. So when someone feels this, a lot of times folks are like going to go online and go, okay, what kind of cushy shoes can I get? What can I do, to stretch my calves or things of that nature? What should they be doing instead? Like, what's the first thing when you're like, oh no, I think I have plantar fasciitis. What should I be doing?
Well, the very first thing I think you should do is get a proper diagnosis. Go and see the right person to be able to understand, is that really what's going on or could it be something else? But if you're looking to do some of the things at home to avoid the morning pain that you're having, that's really why I wrote my first book, The Plantar Fasciitis Plan, was to give people access to what I would tell people. I shouldn't say I don't like seeing people with acute plantar fasciitis, but I just don't think they always need to come and see a specialist like me when there are some simple things they can do first thing in the morning before they get out of bed. And those things are, being able to break out of the cycle of half healing and re-tearing. So just doing a little bit of light range of motion exercise around the ankle, a little bit of ball rolling in the arch to get everything, kind of broken down again. And then wearing something that gives you a little bit of control and cushioning before you take your first 10 steps so that you're not re-tearing things when you wake up and put those feet on the ground for the very first time. That's like the simplest thing that you can do when you find yourself waking up with some morning pain. Now, the best thing you can do is avoid all of the risk factors in the first place.
Yes.
So risk factors being, if you're significantly overweight, if you stand and walk on hard floors for long periods of time, if you've lost range of motion in your ankle because your calf muscles or your hamstrings are too tight, or there's some kind of dysfunction in the posterior, lower limb chain, if you can deal with those things before you get plantar fasciitis, then hopefully we don't have to have the discussion in the first place.
Yeah. Yeah. So I think, probably one of the things that I'm hearing you say is the tearing. And I think a lot of people don't realize that that plantar fasciitis is a tear at the
Yeah.
root of it. And I think we should talk a little bit about that, and then talking about this prevention component and how we should have folks working on prevention and what kind of things they can do. So first, let's talk about this tear business, because I think a lot of people think of plantar fasciitis as just being inflammation at that spot that's like jabbing them like a knife in their heel.
So really, when it comes down to what plantar fasciitis is, I like to explain it to people in that, you, regardless of how you get it, and there's so many different ways you can get it, and there's so many different ways you can treat it. What fundamentally people don't seem to understand is that you go through this cycle of half healing and re-tearing. So you get some micro tearing in your plantar fascia in a variety of different ways. And we can certainly talk about that. But at night, what really starts to happen is your foot starts to shorten as you sleep. The soft tissue starts to half heal in that relaxed and shortened position. And then when you wake up first thing in the morning, put your foot on the ground and put weight on it, your arch lowers, the tissue lengthens again, and you get some quick re-tearing of the half healing from the night before. And so this injury just becomes cyclical. Every time you sleep or rest or sit down, you just get this half healing and re-tearing that happens, which is why you can wind up in this chronic cycle of pain that doesn't go away for months at a time. And you think, oh, my foot hurts, that's bad, it'll get better. And it just doesn't. So the really simple things we can do here to get you out of this cycle of pain is what I call my rest program. So there's 4 different things that we give people. And it's really, reducing your morning pain as much as possible, evaluating your activities so that you can stay active, but remove the things that hurt. Try the footwear that's really going to help you as opposed to hurt you. And then there's all kinds of over-the-counter solutions that can help to reduce your pain so that you can walk and get through the workday and be active without having to compensate.
Oh man. Yeah, that would be ideal, to be able to know what it is that one can do to get through the day without pain. So I think one of the things I'd be asking you is, if someone's listening to this and they're like, well, I don't even know where I would know how to not get into pain. How do they start by kind of putting the puzzle together and sleuthing out what they should do specifically?
Well, I mean, if I want to put a shameless plug in for my book, they can read my book, The Plantar Fasciitis Plan.
Absolutely.
There you go. It's available on Amazon. It is an international bestseller, by the way, which probably means I sold 5 copies. But anyway, that's a longer conversation. The other thing they can do is they can look to specialists for some help. There's lots of stuff on the internet out there. The problem is that some of it's really good and some of it's really not. And so, if you have someone that's trusted that you can go to get some information, that's always a great place to start. Because if you start off with the wrong things, you can really go down a rabbit hole that takes you, through not being able to be active, and then the weight gain that comes with that and everything else. So seeking out the best information is always the best idea to start with.
Okay. So now we've got our information and we've got your book, which we're going to help you to be a 3 times best-selling author. But how do we look at going, okay, we've got this plantar fasciitis, and we keep hearing this concept of orthotics, but we also hear that orthotics can be a myth. So how do we go about this in terms of taking that pressure off the heel? What should we be thinking about in terms of consideration of an orthotic or that?
Well, and that really depends on how much pain you're in. So when people come to me with acute plantar fasciitis, so when you're waking up and you've just started to have pain, the best place to start is that home-based therapy program, right? So it's doing the exercises, it's removing the activity that might be causing some of your discomfort, changing up your footwear to make sure that you're in the right matched footwear for your own foot first. And I mean, that's the simplest three things you can start before you even think about orthotics. A lot of the times we don't want to get people into an orthotic unless they're not responding well to conservative therapy. So what I like to do is have people start with that when they're really in that acute stage and do it for 4 to 6 weeks. And if they don't see significant progress, then they can start looking at things like orthotics. Now, if your pain is so bad that you can't put weight onto your foot and you're literally walking on the outside of your foot because it hurts so much to get through your workday, you're a teacher, you're a nurse, you're someone who works in a factory in steel toe boots on concrete floors all day, then at that point, an orthotic can certainly be a great addition, even early in plantar fasciitis, really to get the pressure off of your heel. And you can try a variety of things. You don't have to always go custom first. There are great over-the-counter solutions between, $25 and $45 that might help to take some of the pressure off of your heel to help you get through the day, to see whether or not doing some of these home-based therapy treatments really do work in the first month and start lowering your pain. If you're not seeing a really good movement on your pain first thing in the morning, you can't wait much longer than 4 to 6 weeks, and you need to start seeing whether it's a physio or a chiro or some kind of foot specialist, your family doctor, someone like yourself, to help get some of this pain gone.
Yeah. No, it makes sense. It makes sense. Now, I gotta find out from you, where's your opinion on these foot boot things that are not so sexy? Do they help? Do they not? What's your opinion on that, or the brace?
Yeah, most definitely. And so night splints have been proven to be effective in some of the research that exists for it. Again, at reducing morning pain when you take those first few steps first thing in the morning. There are other things. For me, I use it as a treatment that's sort of later on in the algorithm, because if your sleep is so fundamentally important for so many things, but really fundamentally important for recovery. And if you're not sleeping well, you're not recovering well. So you can imagine sleeping in a half ski boot or something that, contorts your toes back in this position. You might not be getting the best quality sleep, reaching those deeper, cycles where you're really getting better healing. And so, no, we usually keep it for later down when you're not responding to some of the other therapies that we try first.
Gotcha. Mm-hmm. All right. So if someone comes into Soul Science and they're like, Dr. Dombrowski, I need some help. I need some strengthening. What kind of therapies are you having them go through in terms of strengthening? How do you know if they need strengthening? I think is probably the first question, because I think there's a lot of folks out there that are like, you have plantar fasciitis, you absolutely have weak foot muscles and weak calf muscles.
Well, and that can certainly be the case. And not only can that be the case, but after you recover from plantar fasciitis, when your brain is really good at saying, hey, this part of my body is sore, let's shut it down and not use it as much. Right. So then afterwards, you get sort of like this atrophy of things that happen because you've been sore and walking differently. When someone comes in and they want to do some strengthening, pain is one of the big parts of it that we want to try to reduce. And so, if they're in a lot of significant pain, we really want to try to reduce that before we add in a bunch of strengthening exercises. And so that really depends on where they are at sort of their plantar fasciitis journey. Is their pain under control or is it not? The first thing, if it's not, we work on getting that pain under control. And then once it is, we can add in strengthening exercises. And we do a variety of different tests to see whether or not you have a foot-brain connection, whether or not you can do things like move your toes, spread your toes apart, whether you can lift your arch up off the ground using just your foot muscles and not being able to, cheat by curling your toes weird and doing all kinds of stuff. So once people feel better, we kind of run them through a battery of tests to see whether or not strengthening is a component. And it always is, really, at some point in their journey to recovery. And it's just a question of whether that's early or a little bit later.
Okay. So now I'm intrigued in terms of all these tests. Now, are these tests manual tests, or do you have like equipment that looks at pressure points, kind of like some of the fancy running shoe stores where they can see where pressure points are? What kind of gadgets do you got?
We have everything. So, everything from, ways to be able to test the muscles in your toes by, putting something on the ground, having you try to, grip it on the ground. And as we pull it away, we can measure the force, all the way out to using 3-dimensional motion capture.
Wow.
With my background, yeah, we have a full 3D motion capture lab. Now, we don't do that for, everybody with plantar fasciitis, and certainly to assess foot strength, that's not something that we do often, but we have the capabilities at Soul Science of being able to do some pretty cool things. Most of the time, it's just some simple manual tests that we can do in clinic and looking to see whether or not you have the ability to stabilize on your ankle, to be able to say, yeah, I want to be able to move my toes and I can actually engage those muscles in order to do it. And you'd be shocked how many people can't just simply do that. And so, there's nothing that really bad footwear for a really long period of time can't mess up with your feet. If you don't mind me going down a road for a second, there are some people out there on the internet that will tell you that, footwear is the most evil thing that you could ever put onto your feet, and that, orthotics are collectively making the arches of the world weaker, and, all that kind of stuff. And then there are people out there who will tell you that you always have to wear shoes and that orthotics are the best things for everybody. I tend to be a bit more in the middle, of the two. And I think that both worlds should be able to get along, because there are lots of instances when we use an orthotic as a tool to get somebody better when they're not responding to conservative therapy. And then we can remove that tool just like you would anything else. It doesn't have to be a lifelong, sentence if you use that word in sort of a bad way. But I can tell you that I have a lot of patients who have significant, metabolic disease. They're diabetics who are high risk of ulcer. They have osteoarthritis. They have dropped metatarsal bones that you can't literally bring back up again, who do wear orthotics long term, and it's life-changing for their ability to be active. And I have just as many people that we take out of orthotics when they don't need them anymore.
I like that. I like that concept, because I think some of us do think that, like you said, a sentence, once you get those orthotics, now you're in for it for the rest of your life, and you have to do it. But I like the idea that it's more like just an aid to get you from one step to the next. Yeah. Now, in your book, do you describe some of the exercises that folks should be doing to get from the next stage to the next stage?
100%. So in the plantar fasciitis plan, we walk you through all the things you can do at home. Mm-hmm. And then there are lots of other specialists that have contributed components to the book that kind of give their take on it. So what you should ask your physio, what you should ask your primary care physician, what you should ask your foot specialist, how to know when things aren't going well to move to the next phase. And then once things are going well, there is a small strengthening section in that book, but we're just about to release the second book called Healthy, Strong Feet, The Truth About Orthotics and More, where we talk a lot about what we've just talked about here specifically and go really in depth into a lot of the foot strengthening stuff and why people might or might not need orthotics. Like I said, I really like to give that good middle ground approach to it, where both of these dualistic worlds of yes or always yes or always no can kind of get along.
I like it. No, it's really useful, because when I think about my patients and I think about what I see people struggling with, it's kind of figuring out, okay, I've got this plantar fasciitis. Now what do I need to do? Like, what shoes do I need to throw out and what shoes do I need? And then they get down the pathway of the folks that are doing all the zero drop and don't wear shoes and all that. Sure. And my opinion is that we have to meet someone where we're at, because I've played personally myself in the realm of not wearing shoes, and mm-hmm. I ended up getting plantar fasciitis and some Achilles tendonitis as well. And my ankles were hurting really bad. And I thought, what's going on here? And granted, I'm not going to lie, I went out and was running with no shoes on and doing silly stuff. So it wasn't like I was just walking around. I was jumping, running, doing sports, mm-hmm. lifting, things of that nature. But I, found in that experiment that, this could be quite detrimental to go straight from one way and to the other. So when someone's kind of sleuthing out, let's say we've got a gal who likes to wear flats, mm-hmm. the cheap flat shoes, $9.99 at the store. Hey, they're cute. What the heck, right? Mm-hmm. And she's got some plantar fasciitis pain. And let's say that she has a pretty big arch normally, and those flat shoes do not help that arch at all. So mm-hmm. where would you go in this realm with this gal? Would you be starting to consider, just do we throw out all the flat shoes right away as we're working with things and we put some orthotics in, or where do you go along that line? Because I think a lot of people are going, what should I be doing about shoes? And
For sure.
maybe you have like a for flat foot versus arch foot. I don't know. I'm going to shut up.
When it comes to footwear, again, being the orthotic and footwear expert that I am, and actually we own a really big shoe store here in London, Ontario. So, we do everything from running shoes to casual boots to, all that kind of stuff. We get asked the question every day, what's the best shoe? I want to be active, or I have plantar fasciitis. Like, what's the best shoe? Well, I'm here to tell you there isn't one best shoe. Okay. There's the best shoe for you. Okay. There's definitely the wrong shoe for you. Okay. But there isn't one best one. And so the best thing is to figure out how this is going to fit to your individual situation, your biomechanics, your history of injury, the morphology of your foot, because you might like the way that some of the really cute ASICs look this year, but it just might not fit you properly. And why cram your toes into something that's only going to give you problems down the road? And so, where to start with that is, being able to go to a specialty store where they understand what they're talking about. And that's the difference between seeing somebody who's a professional shoe fitter versus somebody who's just a shoe fetcher. Someone who's going to ask you, what's your size? Oh yeah, you're a 9? Cool, be right back. And, someone who's going to take a time, sit you down, measure your foot, talk to you about what's going on, and then present you with some options. Oftentimes when people come into my shoe store, they're looking for us to tell them what to buy. And we can do that because that's our specialty.
Well, I think there's something to be said about that. And I was hoping you were going to go that direction of getting the old metal thing out and looking how wide your foot is and looking how long your foot is. And I was describing myself. I like to wear the cute flats, and I have a very high arch, but I also have a size 4.5 foot, which is kind of weird, kind of small. And the foot box is very large. And I think that's something that a lot of people, I have duck feet, for lack of a better description for those of you listening to the podcast. I have short duck feet, but I can't fit some of these really narrow shoes. And I think this is a thing with ladies in particular. We go for cute over comfort over fit. Yeah. Because there's a big, broad thing in there. And you kind of mentioned it in terms of the ASICs look good, but they're not specific for our foot. So
hang on. I'm just going to back you up one there. So ASICs are really specific for a lot of people's feet. They just might not be specific for yours. Yeah. So I don't want to single ASICs. Love ASICs, the whole bunch. But it's just one of those things where, you've really got to figure out what works best for you. And even within brands, we've got some people who have been dedicated New Balance people, who wind up being half a size difference or sometimes even a full size difference within the brand between different models. So just because you've always been, a 6 narrow doesn't mean that you actually are a 6 narrow. And having someone to work that through is always a good thing. And that metal thing is called a Brannick device, and we use them all the time.
A Brannick device. Tell us, what is this?
Oh, so the Brannick device is that metal thing that measures your length and your width. Yeah. Yeah. Now we can go one step further, and we also look at your instep height to see, how thick your foot is. And so lots of different ways you can do that. And what's really cool now is there's a lot of really neat technology that where you can use apps, or you can go into the stores and they scan your foot and they can look at the individual data points that your foot represents and then be able to predictively show you the shoes that would actually fit best for you as well. So there's some really neat stuff coming out of there. Yeah. And then there are some people who are so genetically gifted that we could legitimately sell them the shoes, the boxes the shoes come in, and they could just wear those and they'll be fine. We could start the new craze of box running.
Oh man, I know I won't fit into that. That is for sure. Now, here's a crazy thought, and just in terms of the ladies universe and some questions that I get a lot from ladies, because it seems that we have all the dialed in technology for folks who want to run. But there's really no dialed in technology that you see like at a traditional, let's put it this way, looking for dress shoes or something of that nature. Yes, there's the sizes and things, but we don't have the like, hey, you shouldn't be wearing heels kind of component. Or, hey, maybe an 1.5 inch thing would be okay, but that 4-inch, 5-inch heel, nuh-uh, girl, you can't wear that. Now, is there any technology that you have that can spell that out for folks
I can tell them that specifically. I mean, we can show them pressures. So in Shoe, you can show them their plantar pressure to say, hey, see this gigantic spike in pressure right here? Maybe that's not a good idea for you to be wearing that. Or what's really interesting is people will come in and we'll do one of these pedigraphs, which is a plantar pressure analysis, and say, look at this like dark area right here, and they go, yeah, my foot always hurts there. And then it's just a great jumping off point. I mean, there's always that saying of, can you see what I'm saying? Well, we can literally visually show them that. And it's a great jumping off point. It's the best $100 tool any clinician can buy to be able to show their patients, what's going on, kind of where the rubber hits the road.
Nice. Well, that helps me to kind of know, all right, we got to be looking for pressure points for all of us, my ladies in my practice that like to wear the fancy heels. I'm not naming any names at all.
And if they start with things, if they already have, small bunions, or if they have a family history of them, that's where you want to really talk to them, is being able to reduce progression of things like that. Because, that's where you're going to get into troubles down the road is if you're in those shoes for too long of a period of time.
Yes. Oh my gosh. It seems that bunions do go along with plantar fasciitis a lot.
Well, they certainly can, because as that first metatarsal phalangeal joint starts to become incongruent and very hypermobile, so as it starts to move more, as the bunion gets larger, the whole inside part of your foot becomes more mobile, which means it can move more, which is just going to increase the strain on your plantar fascia and put you at risk of developing plantar fasciitis. Doesn't mean you're going to get it. It just means you might be at a greater risk of getting it.
Okay. What about folks that have rolled their ankles a lot in their history? Any risk there?
Again, if you've really done a number, and if you've torn ligaments like your ATFL ligament and things that are going to reduce the structural integrity of your foot, I mean, that alone can cause more your foot to move more, which again might not outright cause your plantar fasciitis, but could be a risk factor. The other thing is, if you're chronically rolling your ankles and there's pain involved in that, compensating in the gait, so walking differently to deal with that pain can also set you up for developing plantar fasciitis. So it really isn't uncommon that people come to see me because they had a secondary injury or surgery or a sore knee, and they started walking funny, and that funny way that they walked increased the strain in their foot, and then boom, they wind up with a new foot injury.
Yeah, that's funny. I mean, it's not funny when you're the person that ended up having multiple issues in that case. And this is one of the things that I do find commonly when I've sent folks to podiatrists in particular. We will see that sometimes one issue kind of perpetuates another. We correct one thing and then something else will show up. You find that happening quite commonly. When you correct one thing, you see something else?
100%. And where I see it a lot, especially in plantar fasciitis, are people who get knee replacement surgeries. And so all of a sudden they've been walking around bow-legged their entire lives. And then with this knee replacement surgery comes a straightening of the angle of their knees, which ends up changing the mechanical axis of their foot. Now they're in a more pronated position, which again, pronation itself doesn't cause plantar fasciitis, but it changes the strain on the soft tissues. And when you've been used to doing one thing for years and years and years, and all of a sudden you make a huge switch and you start walking on that switch 10,000 times a day, it can sometimes lead to foot problems and pain.
Oh my goodness. Yeah. It's like they say, we're kind of this chain all the way up. Got to look at the feet first, and then we have to start to kind of work things backwards through there. So.
I learned in school that the foot bone was connected to the leg bone, and it just keeps going from there. And so, 100%.
That song didn't lie, man.
Well, no, it didn't. It didn't.
Was the way to go. Now, you have 2 books, and I want to highlight both of those and make sure that folks know that these are 2 great resources that they can use together, correct?
Thank you. Yes, they can.
So tell us once again, because you mentioned the one, and now we have another one. Is the second book out yet?
It comes out in about a week. Right now, we're at the beginning of November, so I'm not sure when this podcast will go to market, but sometime in early November, the second book will launch. So the plantar fasciitis plan I wrote in 2016. That's been up for a couple of years now and doing really well. And then Healthy Strong Feet is about to launch in the next few weeks. And that really dives more deeply into foot strengthening. And on our companion site with that, which is stuffaboutfeet.com, you can go on, you can watch me give a small lecture about foot strength and how this whole footwear, orthotics and stuff really work, and take a little course on how to strengthen your foot.
I love it. I love it. Manage it, then strengthen it afterwards. It sounds like that's the name of the game. And that seems to be what I have found to be useful as well in my practice. So I love it. And if folks are in the London, Ontario area, we have Soul Science. You can find Dr. Dombrowski there. And are you doing any online stuff in terms of if someone wants a consult online? Are you doing anything these days with all
100%. Yeah.
Awesome.
Yeah. So they can get to us from soulscience.ca or through stuffaboutfeet.com. Either way, we can certainly take a look at where they are and where we might be able to offer some solutions for them.
Excellent. Oh my goodness. Thank you so much for coming on and giving us such great information on the plantar fasciitis conundrum that it is in the office. I appreciate it because, boy, it's one of those things that's tough to treat, and having someone that's a specialist in your back pocket to know what to do when you're not getting the traditional response, when you're not getting a response is great to have.
No problem. And, if you're ever interested down the road, for your listeners and your the people who come and subscribe to your stuff, we could always do in kind of an AMA where we can come on and ask some questions, and I'd be happy to provide some answers.
Yeah, I would love to do that because I see a lot of people in general because of my acupuncture side of my practice with plantar fasciitis. We treat pretty much, a lot of the foot and also the calves and the whole leg for that matter and body. But it does tend to be some things where there's some questions around it. And I think the biggest thing, we just went through is all of what shoes do I get? What do I do about orthotics? Do I need them? Or
even where to start. We've got some people who come in and they started with an injection before they did any exercises, before they got out of bed. Or they're contemplating surgery, which we really try to avoid at all costs when they haven't done just some of the simple things that they could do at home. So having an algorithm of knowing where to start and then what to go to. If this thing doesn't work, you move here. If you're not doing well, you go to this one. That's really what we try to lay out.
Nice. And I'm guessing your book has information on that as well.
It's all of it, yeah.
If this, then that. If that, then this. Perfect. I love it. I appreciate you giving us all of your information, and I will be passing on all of those books to my patients as well. In addition to all of the notes here, folks, at drjkrausend.com, where you can find the podcast notes from this episode of The Health Fix. Thank you so much for coming on.
Oh, thanks for having me. I really, that was fun.
Hey, health junkies, I hope you enjoyed my podcast. If you want to continue the conversation based on what topic I'm talking about at any given time on the Health Fix podcast, head over to my Facebook group, Find Your Health Fix. It's where we are talking about what's going on in health, what I'm talking about in the podcast, and I love to answer questions there. So come hang out and join the conversation. And by the way, right now I have a free Manage Your Stress Naturally course that you can grab on my website at drjkrausend.com, because so many people are stressed out right now, and really it has to do with the basics, your routines and simple habits that are messing you up. So head on over to drjkrausend.com and go check out my free course on managing stress naturally. All right, folks, have a great day, whatever you're doing.
Subscribe, rate, and share info.